Welcome to Alberta Health Services, and congratulations on your decision to become a volunteer with the Central Zone. Each and every day, volunteers are engaged in meaningful activities and programs that make a positive impact on the lives and healthcare experiences of our patients, residents, clients, families, and our healthcare professionals. We hope you enjoy your time as a volunteer. Remember, you create your own experience. Make the most of it. Volunteering is all about sharing your talents and skills, offering care and compassion to those in need, improving the quality of life for the citizens in our communities, feeling empowered, being creative, and having opportunities for growth, having fun. Here, have a listen.
Hi, I'm Sarah.
Hi, I'm Kiara.
And one of the things that I love the most about volunteering is getting to make people smile.
And one of the things I love the most about my volunteering is I get to give back to the community and help the people who need it the most.
My name is Candace Miller and I'm a volunteer. I instruct one of the Better Choices, Better Health courses. And I volunteer because I learn a lot from my group and I have the opportunity to help others. But I really enjoy meeting others, and that's really why I do what I do. Not everybody else gets the chance to get out there and help other people, and I really want to show my family and my young family and my daughter that helping others is very important, and this is one way I can do that.
Hi, my name is Wanda. I am a volunteer, and I volunteer my time to be with a mom in a constant position through her labor and the delivery. I am also there for the dad as well, and a support to the staff through the entire labor and delivery process. The best part of my job, of course, is to be there to witness the miracle of birth and the new life that is brought forth. And then later I share the experience with them through a birth story.
Hi, my name's Jamie and I like to volunteer because I like to form a relationship with someone. I like to be able to go into their home and visit once or twice a week or whatever works best for both of us and ask how each other's week went. Did you have a good time? What did you do? And be able to form that continuous friendship.
Hi, my name's Morris Paul, and I've been volunteering in this hospital for just about 12 years now. I would encourage anybody who wants to volunteer to think about that. You know, if you can spend a few minutes of your time to make somebody else's life better, that's great. So that's the way I look at it, and that's what keeps me coming back. So folks, volunteer.
Hi, I'd like to tell you about our volunteering. We really enjoy coming here and bringing our pets. The pets love it. My husband and the big boxer have been coming for about 7.5 years. So Rocky's his name. He was 2.5 years old when they first started, and now he's just turned 10. And the two little dogs, the black and white Jack Russell, he is now 14 years old, and my little poodle is 4 years old. And they absolutely love coming here. The patients love him, the staff love them, they like to talk about their pets, and it really is worthwhile. It's a really nice experience to see how patients respond and smile and visit about pets they had. And that's the thing about bringing pets. They have a chance to be with animals again.
Alberta Health Services. 2016 sees the introduction of 5 core values, values that inspire and empower us. Values guide our decisions and how we work together with patients, families, and each other. AHS cares. Our values are compassion. We show kindness and empathy for all in our care and for each other. Accountability. We are honest, principled, and transparent. Respect. We treat others with respect and dignity. Excellence. We strive to be our best and give our best. Safety. We place safety and quality improvement at the center of all our decisions. Why? AHS cares. Our vision, healthy Albertans, healthy communities, together. Reflecting our commitment to strive to live our values every single day. And by our actions, we will show that caring is as important as care. Living our values together. Alberta Health Services. AHS Code of Conduct defines how you as a volunteer can contribute to our reputation as an organization. The Code of Conduct gives 5 general points that guide our behaviors as volunteers. Always treat people with respect, compassion, dignity, and fairness. Be open, honest, and loyal. Act ethically and professionally. Take responsibility for your own actions and expect others to do the same. Respect confidentiality and privacy of others. You are now ready to commence your role as a volunteer and contribute to making a positive difference in the lives of others. You will learn so much about yourself and have so much fun. When you volunteer, you become part of the professional healthcare team. You will be issued an AHS photo identification name tag that should be worn at all times when you are volunteering. This helps to make a safe, secure environment for patients, staff, and volunteers. When you wear your photo identification, make sure it is visible and easy to see. If you lose your tag or it is stolen, please report to Volunteer Resources staff immediately. A replacement will be issued. However, there may be a replacement fee for lost or stolen cards. Good hygiene and appropriate clothing are basic to a successful volunteer experience. Volunteer Resources staff will tell you if there are specific dress code guidelines for your assignment or if a uniform is to be worn. Otherwise, your dress should consist of a clean top and pants. Please refrain from wearing sweatpants, track pants, shorts, or tank tops. Footwear should be comfortable, low-heeled, and closed-toed. Sandals or flip-flops are not appropriate. We ask that long hair be pulled back and away from your face. Please refrain from wearing nail polish, and as we have a scent-free policy within AHS, we ask that you do not wear any perfumes or other scented product. Your commitment and dedication is vital to the whole team. Making sure you arrive on time for your shift is extremely important. Our patients look forward to your visits, so we want to ensure you know and understand the value you play as a volunteer and what your commitment means to both the patients and staff. You will need to record your hours, as it is important we provide senior leadership with statistical reports of the time contributed by all volunteers. You can also benefit from recording your hours, as this information may be needed for future employment, education application, or to expand your resume. The actions, behaviors, and performance of volunteers are observed by patients, staff, and visitors at all times. All active volunteers are covered by AHS liability insurance, as well as workers' compensation. For this reason, volunteers must recognize their limitations and not perform tasks outside the scope of their assignment. AHS will act on behalf of the volunteer, except if the volunteer's actions are willfully negligent or criminal in nature. As a volunteer, we ask that you refrain from loud noises, inappropriate language, or misuse of facility equipment or property. Do not toilet, bathe, or dress patients. Do not lift, transfer, or position patients. Do not enter off-limit areas. Do not enter an isolation room if you do not feel comfortable. If you choose to enter, you must be instructed by a nurse on safety precautions needed to enter the room. Refrain from giving medical advice to patients or families. Never give a patient any kind of medicine or pills, alcoholic product, cigarettes, or matches or lighters. Do not accept money or gifts from patients or family members unless it's a thank you card or perhaps a small box of chocolates. If a patient wishes to give a larger gift, it is best you contact the Volunteer Resources staff so they can assist you in responding appropriately. Electronic devices can cause interference with medical equipment and can also be a distraction. We ask that you do not use a cell phone, text messaging equipment, music player, or other electronic devices while volunteering. Urgent incoming phone calls can usually be received through the Volunteer Resources Department. Be aware of signs and workplace hazards. If you come across a spill, be sure to confine the area and alert the staff immediately. If you are asked to use your personal vehicle to transport a patient to an appointment, you must be registered as a designated volunteer driver with Volunteer Resources. This will be explained to you if the need arises. Maintaining confidential information is extremely important. In the performance of your volunteer duties, confidentiality involves keeping all privileged information private. Volunteers should never discuss a patient's health information about another patient, family member, yours or theirs, or other volunteers. Volunteers do not have the authority to release any information or ask for information they do not need to know to complete their assigned tasks. If asked for information by someone else, volunteers should refer those individuals to a staff member in charge. This includes any inquiries from the media.
Hello.
Hi, may I help you?
Yes, I am here to see Bruce Lurie, and I would like to know how he's doing.
I'm sorry volunteers aren't allowed to discuss a patient's condition, but I can
Okay.
take you to the charge nurse and you can
Sure.
ask her about your friend.
All right.
Okay.
Thank you.
Has a question? Oh,
Hello.
I'm Brenda,
I'm Bob.
charge nurse.
I'm here to see Bruce Lurie.
Okay. And can you tell me, are you a friend or family?
Friend.
Okay.
Yeah.
When's the last time you saw me?
Remember, what you see and hear stays here. Breaching confidentiality is grounds for dismissal. You may be asked to terminate your volunteer assignment for these reasons as well. Extended absence with no explanation. Volunteering while under the influence of drugs or alcohol. Failure to follow AHS policies and procedures, resulting in a threat to the safety and security of patients, staff, visitors, or other volunteers. Or if it is in the best interest of the volunteer or placement department. Preventing the spread of infection is everyone's responsibility. If you have a cold or flu-like symptoms, fever, rash, or other symptoms, please refrain from coming in to volunteer. It is up to you to inform your placement area staff or volunteer resources that you will not be in for your shift. One of the single most effective ways to prevent the spread of communicable diseases and infections is proper hand washing. Following these 7 easy steps. Wet hands with warm water. Apply soap and lather thoroughly. Rub palms, spaces between fingers, backs of hands, and wrists for at least 15 seconds. Rinse under running water. Pat hands dry with paper towel. Turn off tap with paper towel. Place towel in the garbage. Be sure to keep up to date with your immunization, flu shots, and if you travel overseas, please notify Volunteer Resources staff before returning to volunteer. Always stay informed of outbreaks within the facility. AHS is committed to safe, quality care, services, and treatment of patients and their families. The Volunteer Resources staff will ensure you are up to date on policies and procedures. Remember to always be aware of your surroundings, and whenever possible, remove yourself from situations that may cause you injury or harm. If you experience or see others in an aggressive or abusive situation, report it to a staff member immediately. AHS emergency codes are something you also need to be familiar with. There are signs posted at all facilities. Check out the back of your ID tag for a quick reference guide. Be sure to check with your supervisor in your assigned area for specific procedures and how you as a volunteer can assist. The following is the standardized emergency color code system in all AHS facilities. When spending time with the patients and residents, you will want to seek out what activities they would enjoy doing with you. Check with the nurse in charge, who will be able to identify those clients that would benefit from your companionship. Activities such as doing a puzzle, playing a board game, reading, watering their flowers, or taking a patient for coffee are just a few of the ways you can brighten their day. Remember, your role as a volunteer is to provide companionship and not care. Your volunteer assignment may include moving a patient in a wheelchair, This can be an enjoyable, safe, and comfortable experience for you and the patient. These guidelines will help you. Make sure you first receive permission from the nurse in charge you are taking a patient or resident off a unit. Approach the patient cautiously so they are not startled. A gentle touch to the arm or shoulder often helps in getting their attention. Always introduce yourself. When talking to a patient, remember, place yourself at their level so they do not have to lift their head to speak with you. Ask the patient if they are ready before moving them. Tell the patient where you are taking them. Check to make sure the patient's arms are resting inside of the armrest and not hanging over the side of the wheelchair. Make sure the safety belt is securely fastened. Watch to ensure patients' tubing, clothing, and blankets do not become entangled in the wheels, brakes, or footrests of the wheelchair. Make sure the patient's feet are securely placed on the footrests. Avoid quick stops and watch for changes in the floor surfaces. Stay alert and unhurried. Learn to use available mirrors to watch for oncoming traffic, especially on corners. Take care when entering an elevator so small wheels at the front of the chair do not drop into the crack between the floor and the elevator. The safest method is to turn the wheelchair around and back into the elevator. On a ramp or steep incline, guide the wheelchair backwards down the ramp and forward up the ramp. Move backwards down over a curb and push the wheelchair up onto a curb using the foothold to tip it back. If you are asked to take a patient to a specific area, always stay with the client until the supervisor in charge is notified the patient has arrived and has given you permission to leave. Inform the patient you are leaving before you go. Park empty wheelchairs so doorways are never blocked. Make sure the footrests do not stick out and cause an injury. Report unsafe broken wheelchairs to a nurse in charge. Remember, safety of our patients is everyone's concern. Do your part in keeping them safe. AHS values the commitment and dedication of our volunteers. One way we acknowledge and recognize you for your hard work is by our Years of Service Awards. AHS volunteer service pins are presented to volunteers after 1, 3 years of service and every 5-year increment thereafter. As a volunteer, you may also be part of the AHS Employee Milestone Awards program, which provides a special gift for volunteers reaching 10+ years of service. In addition, events are held throughout the zone to celebrate the commitment and dedication of your service. You are certainly welcome to attend workshops or training sessions that are offered throughout the year. These are good opportunities to meet others and exchange ideas. Sessions will be posted on the Volunteer Resources Bulletin Board or included in the volunteer newsletter. Volunteer programs are evaluated regularly. We will seek your input to help keep our assignments meaningful, both to you and our patients. Individual evaluations will also be completed on both an informal and formal basis. Feel free to discuss any problems you may have with your supervisor in your placement department and/or volunteer resources staff. If you need to be away for an extended period of time, please give as much notice as possible to the Volunteer Resources Department. During this leave of absence, we will make every effort to schedule another volunteer in your place. Upon your return, we will make every effort to place you in the same position. If you do not return or provide further notification after 12 months, your status will be moved to inactive. If you wish to end your volunteer assignment, please notify Volunteer Resources staff as far in advance as possible. You will be expected to return your photo identification and any other items related to your assignment. You will also be asked to complete an exit evaluation. We hope this video has provided you with the information and tools you will need to have a rewarding volunteer experience. As a volunteer, you have the potential to make an important difference in the lives of our patients, residents, and their families. Welcome to our team.